All right, good afternoon, everyone. We'll give it a minute as people are joining our webinar today. Hi, Yuri.
Hey, Megan. Hi, guys.
All right. Well, let's go ahead and get started. Thank you so much for joining us today for the release of our new report, Addressing Gaps in Emergency Response Systems for Older Adults Impacted by Wildfires. My name is Megan Rose, and I'm the General Counsel and Chief Government Affairs Officer for LeadingAge California. LeadingAge California, LeadingAge Pacific West, we are one association representing over 800 nonprofit providers of housing, care, and services for older adults across California, Nevada, and Hawaii. We are so glad that you are here today. We're coming together to learn and share and work together to strengthen our emergency response capabilities for the future. And so our new report is available on our website, and we will put the link to it in the chat. If you go to leadingHCA.org, under the initiatives tab on the top right-hand side, you'll see the emergency response page, and you can click through to that and have access to the report, which you can download and share. Today's webinar is being recorded and will be available along with the slides that will be presented. And we want you to ask your questions throughout the session. So please use the chat feature on your screen if you have questions. Our staff will be monitoring and we will address them in between kind of the sections of our agenda today. So thank you again for joining us. So we're here because in January 2025, horrific, swift-moving wildfires struck Los Angeles County. And the wildfires revealed how profoundly older adults depend on the state's ability to protect and support them in times of crisis. The Eaton and Palisades fires claimed at least 31 lives, and all but four of those lives were victims over 65 or living with a disability, which is just a devastating reminder that our older adult residents are disproportionately at risk in emergency situations. Long-term care mutual aid is an issue that we at LeadingAge California have been working on for many years. And when the fires struck Los Angeles, it created a heightened sense and a heightened need for action. And so throughout the months after the fires, we had several conversations with our friends at the SCAN Foundation, at the UniHealth Foundation, about how we could partner to conduct a gap analysis of California's emergency response, specifically how it relates to the safety and health of older adults. And so after months of work, we are so excited to release this new report, which was made possible by the generous support of the SCAN Foundation and the UniHealth Foundation. And so to write the report, we partnered with Tamiza Teja of TZT Consulting, who is the author. Tamiza is the principal and owner of TZT Consulting. She has over 20 years of experience in emergency management, specializing in the medical and health sectors. She has broad experience helping organizations operationalize their emergency plans and in designing and conducting a variety of teaching and learning modalities where she has conducted over 400 trainings, tabletop exercises, and full-scale exercises. Tamiza served as a maternal and child health Peace Corps volunteer in Morocco and is a retired pastry chef with a nutrition degree. So today, Tamiza will walk us through the report, including her methodology, findings, and recommendations for providers, stakeholders, and government partners. And then we are also joined in the second half of our webinar. We will be having a panel. And so we are joined by some wonderful providers who have been impacted by the wildfires. We have Sean Rushforth, who's the executive director at Villa Gardens, a Front Porch Life Plan community. We have Yuri Escandon, the vice president of operations for Retirement Housing Foundation, which has affordable senior housing across the United States. We have Keith Kaysen, Chief Operating Officer at Hillcrest, which is a life plan community, and Andrew Pigsisian, Chief Operating Officer from All Care Home Health and Hospice. And so without further ado, I'll now turn it over to our report author, Tamiza Teja, to walk us through the report. Thank you.
Great. Thank you so much, Megan. All right, give me a second, everyone, to share my uh, screen here. Make sure. Ooh, let's click the slideshow button again. Okay, everyone there with me on the slideshow?
Yep, we can see it. Thank you.
Ah, awesome. Thank you so much. Again, I also just want to thank everyone who's here with us today, attending this webinar. Uh, I live here in LA, and so it was just so devastating over the news, just to see what's going on. I was doing a little bit of work behind the scenes during the wildfire response as well. So when Leading Age, said that they wanted to do something in this area, I was really excited to be a part of it. All right, sure we can go ahead. And me and LeadingAge really want to thank all of the stakeholders who participated. They generously shared their time, their expertise, their lived experience through the interviews and sort of other related discussions. And I recognize revisiting the wildfires and its impacts even a year on, I'm sure was stressful and emotionally difficult. And I just want to again just reiterate that thank you for the amount of information they shared, how candid they were in their responses. I think it really helped to make the information that you'll find in this report more robust and more sort of well-rounded in the different topics that we were able to address. I did put the link in the chat to the report as Megan was talking. It's currently just right on the front page of the LeadingAge California site, and then it's housed there under the initiatives page. And then I added the QR code here, which takes you to that initiatives page for you to download it. I know when it initially got released, there were a few folks that were having some issues with the download, but I think the IT team has got that all sorted, and hopefully we won't have any problems. If you are still having problems downloading the report, let us know. And I think we'll be able to get that just emailed out to you. And if you have any questions or comments, like was said, please use the chat. I'm going to try and keep an eye on it. I have the chat open on another screen here. So if you're looking kind of back and forth, try and address some questions if it's directly something I can answer quickly with something that's on screen, or maybe it'll be something that we can capture and talk about later on. So just a little quick overview of how the report is structured. We have a really nice executive summary in the beginning, and an overview of the project, which I'll be going over a little bit here. And then based on the information, we've come up with recommendations and broken those down by emergency management phase. So planning and preparedness has a page, response, and recovery each have their own page. So the way the structure is that the recommendations are up front. You can just go really quick, straight to those, get some good information in the executive summary and then the recommendations. And then all of the findings were consolidated together. And these include a summary of the stakeholders' reported experiences, observed practices, includes challenges, gaps, and concerns, elements of success and effective practices, and all of those are over 30 pages. So that's why we decided to put the recommendations just kind of right up front so you can see those real quick. But I do really recommend, if you have the time and the interest, to read through the key findings. I think you'll find it really interesting, and there's a lot of really sort of meaningful information in there as well. I included just a quick kind of fire timeline and then some acronyms and definitions. The 30 pages of the key findings, those are also broken down by emergency management phase, disaster planning and preparedness, response and recovery. And then within each one of those, just sort of based on how the findings kind of found themselves together in these various topic areas. So in planning and preparedness, we have sort of the planning process, trainings and exercises, equipment and resources, and then to address some general concerns for older adults in that phase. And in response, a lot on coordination, communication, and notification, destinations for evacuation, transportation, continuity of care, and then regulatory agencies, regulations, and compliance. In the recovery section, we're focusing there on, again, general concerns for older adults, staffing, mental health and behavioral health support, and then just a few sort of additional thoughts. So, like I said, there's 30 pages of these. I think there's a lot of really great information there. I had a really amazing time visiting with our stakeholders for this. So I don't know that I have to. I think our audience is pretty, familiar with why older adults require focused analysis for the disaster, but just wanted to highlight these particular topics of limited evacuation mobility and the reliance on assistive devices, higher continuity of care dependence, general vulnerability to smoke exposure and power and utility disruption, increased likelihood of disorientation, anxiety, and destabilization during displacement, and a higher coordination burden for tracking reunification, placement into the appropriate care settings, and repatriation. A lot of these topics you'll kind of hear a little bit over, and as we go through sort of the way the report is structured, you'll see a little bit of repetition in some of the topics, but it kind of applies into different categories of information. And then also in some cases, really just wanted to reiterate some of the concerns and some of the strengths that we saw during the response. So the objectives of the whole project were to document stakeholder experiences, their challenges and resource gaps during the wildfires, identify any systemic weaknesses disproportionately affecting older adults. And for this project, because of the membership for LeadingAge, we did speak to a lot of the staff and also residents in congregate living and higher acuity environments. We did speak to some residents who were out in the broader community, but in terms of the report, a lot of time, most of the time when we say community, it's referring to sort of the congregate living situations. And then also to develop actual recommendations, short-term and long-term, and really looking at how we can strengthen emergency management capabilities across the continuum of older adult care and services and all of the different partners that we would bring together to be able to provide this appropriate care. So again, a little bit on the methods and activities. So it was really interesting. So there were this situation was so different in some cases, in that oftentimes, we look at after action reports, and there was so much litigation for this particular incident that I couldn't get to a lot of the documents straight away, but towards once we finally got going, a lot more of those reports started to come out. And I actually did read a lot of the news that came out at the time and trying to see kind of what was being projected publicly through the media, and then really hearing it through the interviews, sort of what was sort of the real kind of truth in that way, and kind of wanted to see where we might need to address those issues in the future. And that actually came up as one of the recommendations, and sort of how to deal with the media. So I had 22 structured interview sessions involving 47 participants. And then I also participate ongoing in the Los Angeles County Healthcare Coalition meetings that happen throughout the county. And I regularly attend those. Even before we got started on this project, I was already at those meetings, kind of hearing sort of the different concerns and lessons learned and strengths from the wildfire response. And then looking at putting these all together into our final report. So there were, again, 2-hour structured interviews. One of the big important things was that these were confidential. I was the one attending them, taking the notes. These were not recorded. I wanted people and our participants to feel comfortable, to feel as confident that what they were saying was going to stay confidential. That's why none of the information in the report is attributed to anyone in particular. If someone participated as an interviewee, I'll leave it up to them to self-identify themselves, because I think the confidentiality really did help to elicit some really good details that we might not have been able to receive otherwise. So I'm trying not to read every word on this slide. I promise. I just feel like we had so much good information. Okay, moving on because I want to get to some of our more additional details. We had a broad range of participants. We had leadership at the different communities with skilled nursing facility leadership as well, residential living managers, facilities, environmental services, safety, security, case managers, social support service staff, residents in the communities, as well as those who had to evacuate from their homes, as well as the ombudsman. So again, just the range of our participants, these CRCs, RCFEs that had a mix of services that they provide with independent living, assisted living, memory care, skilled nursing, and standalone skilled nursing, affordable senior housing, home health, IHSS, waiver services, all kinds of representatives, and really excited to have been able to speak to all of these folks, and they were interested in participating. The range of also their experience with the wildfires range too. Some fully evacuated their campus facility or home. Some were just a partial evacuation, meaning they part of their operation stayed on campus, others fully evacuated off the property, some sheltered in place, and then also some of the communities received evacuees from other locations. So it was nice to be able to get that breadth of the experience from the wildfires as well. So these are a few thoughts from older adults who lost their homes. And really the one that's kind of in the center for me there is the thought and feeling that we were left to burn. And it's really, as an interviewee who's trying to capture the information, so much of it is just heartbreaking, but there were also positives and lessons learned out of this too. But I just wanted to share a few of these thoughts with you, and they'll fit into some of the major themes that we saw, as well as some of the recommendations. So in the report, in the executive summary, we have main themes identified. And so strong mutual aid and peer-to-peer support across communities was repeated by several of the communities. Many organizations and residents actively sought ways to support affected sites. They offered space, supplies, donations, durable medical equipment, and other types of assistance like gift cards, buddy systems, just different ways that they were able to support not only maybe residents who came to their facilities, but as a facility, we're not being impacted at all. How can we support another community across town who is being impacted? We saw effective incident leadership practices in some settings. If they had the time and capacity to activate their internal command structures, like their emergency operations centers or the incident command systems, they were better positioned to conduct ongoing situational assessment, being able to do consistent communication with their staff, with their residents, with family members, and make more timely decisions despite all of the uncertainty of, are we going to be impacted or not impacted, or how long do we need to wait before we need to make a decision? And so having this sort of pre-identified methods for consolidating their team and their information was effective for those. Operational adaptability and problem solving under rapidly changing conditions, kind of following along the same line. Participants described creative workarounds and rapid adjustments to overcome transportation shortages, unclear communications from other facilities, from regulatory agencies, from other responders, staffing constraints, and shifting evacuation needs. Last year on the strengths, staff and resident solidarity supported continuity and recovery. Very strong internal community culture helped sustain operations with residents showing patience and support for the staff as some of the staff were being impacted by the wildfires, and organizations increasing flexibility to stabilize employees affected by displacement or loss. So really being able to recognize it's one of these situations where we're all being impacted by it in some way. And we saw a lot of strength in the way of being able to support our staff as well. Some gaps and challenges. Evacuation timelines and decision making did not consistently reflect older adult needs. Um, Older adults often require substantially more time, staffing, resources, and coordination to evacuate safely, particularly residents with higher acuity needs, mobility limitations, and cognitive impairment. Participants emphasize that official evacuation timelines and responder expectations did not consistently account for these operational realities. And as a result, many communities recognized they would need additional lead time and proactively began evacuating planning and mobilization efforts before receiving definitive direction. Again, these were in those organizations that had had some type of command center or incident command system already kind of in place. So they already knew to be able to gather together, to be able to assess information, and it really helped to then prioritize resident and staff safety. Government coordination and sector-specific operational support were inconsistent. Uh, and that also kind of then flows to evacuation placement and destination coordinated lacked centralized structure. Communities relied heavily on their informal relationships that they had, which great that they had those relationships already built up with colleagues, and ad hoc tools like LeadingAge California shared tool helped identify what the needs were, and then also those who were able to fulfill those needs, they were able to get matched up. Ongoing transportation and staffing constraints were persistent barriers in a couple of different ways. So being able to get transportation into a location in order to be able to evacuate. And similarly, because of the timing of the fires in early mornings, there weren't already a lot of staff on site in some cases. And then once the evacuation zones were set up, even if communities were able to arrange for transportation and more staffing to go to the site, they weren't able to get into an area. So it they couldn't transport out and use the same equipment to go back in to get more evacuees to bring them out. So it was sort of just different barriers, like the trying to get out and also trying to get back in to get back out. Next, continuity of care was disrupted during evacuation and relocation, as you can imagine. Shelters and temporary sites were not consistently equipped for older adult needs, and we'll get into a little bit more on that for the recommendations. Regulatory requirements created uncertainty and operational burdens. A lot of the participants, they were constantly being reached out to by different agencies for information, and really just for information. It wasn't going to help them in their response, and it just took more time away from being able to actually work on the evacuation. Behavioral health impacts were significant and prolonged. Behavioral health impacts are still ongoing. Recovery assistance processes were not consistently accessible or equitable. And I think we saw that quote from before. There's so many things online, not everyone is able to manage the technology aspect. Or if you've lost all of your technology tools in a fire, how much can you afford to now go buy another one in order now to do all of the forms and other things you need online? So I want to point out that for these recommendations, this is not, okay, here's recommendation one, and this is who needs to take care of it. These are not isolated responsibilities, but really a lot of this work needs to be done together collaboratively across organizations and agencies, and really the moving forward together. Success will depend on being able for all of the stakeholder groups to be able to get together and make this a priority to recognize how we can strengthen emergency preparedness for our aging population. So the target audience, like I said, I have another slide on this just to reiterate that it's going to take all of these different partners to be able to work together. Our provider organizations who do the direct service and delivery care, and also their healthcare partners who support across the healthcare continuum. We're kind of all in it together. The local and state agencies need to be able to provide assistance, provide oversight as well. And then the policymakers, what are the legislative and regulatory frameworks that we need to have in place so that we're working together across and within all of these different layers to be able to affect some good change. So, as I mentioned, the report has the recommendations, but sort of one pagers. And so I've gone ahead and just done the slides this way as well. So you can see what all of the recommendations are for each of the planning emergency management phases. So starting here with planning and preparedness, EOP usability and accessibility. Those of you that have ever written your EOP or have needed to use your EOP in an emergency, recognize that it's not always easy to pull off that 4-inch binder off the shelf. First of all, who knows where it is? Who's flipping through hundreds of pages to find what you need in the emergency? So I think the organizations recognize that we need to have better sort of quick reference checklists to be able to enact what we've already come up with in calmer times in our plan in our EOPs. Number two, oh, and also I just want to say these are numbered, but they're not priority numbers. They're just numbered for sort of ease of reference. Number two, scenario planning and preparedness scope. I would say universally, everyone was prepared for an earthquake. That was sort of the big bad hazard that everyone was preparing for was an earthquake, even including, the folks that were prepared who were living at home, not just the communities. And I think the wildfires really caught everyone by surprise that it could spread so quickly that would have so much of an impact. And so I think there's just recognition that we need to move beyond just earthquake and maybe even not so much what the actual hazard is, but really sort of what we might need to do in our response. Like, how are we going to do a rapid evacuation? What's that timeline like? What is it going to be like if there's widespread displacement? What do we do if there's extended power disruptions? What do we do if there's prolonged recovery operations? Like, so really sort of looking at some of the broader issues and not necessarily just thinking about one particular hazard as the cause for what we need to plan for. Number three, sustained preparedness capacity and funding limitations. Everybody I talked to, they wanted to be better prepared. I mean, they kind of volunteered to participate. So they had a stake in this, but they said they wanted to be better prepared, but in some cases they just weren't sure how to do it. In other cases, they recognize the need. They need to have more staff time to it. They need to have more resources, but there's just the funding limitations. So trying to figure out how we can do this. Again, that's something we're coming together, might be helpful. What things can potentially be grant supported? Are there grants available out there? What resources maybe can be shared, some type of shared preparedness capacity model. So trying to figure out how we can keep this going. And that was also a big fear is that, every time we have a disaster, people are like, yes, we need to do something about it. And you get this momentum and then it kind of dies off. So how do we actually keep it going and really make it sustained? Number four, role-based training, cross-training, competency reinforcement, just wanting to make sure folks really understand their roles in the emergency or a disaster, doing a little bit of cross-training. And I thought one organization, they have different locations and what I thought was great is with their staff, if they had staff who lived closer to another organization, they promoted cross training so they could see how they could do their own skills and normal roles, but at a different location. So not only was it cross training in skills, but cross training at different locations so that they could help surge into different places and really help support that. And from the evacuation perspective, because there was so much congestion and people unable to get into areas by having other staff already who kind of live close by, they were able to provide some surge response to a totally different facility than they normally work. And it worked out really well for them. Number five, cross-sector preparedness, integration, and healthcare coordination. So I attend a lot of the healthcare coalition meetings, and one of the big things is that we always expect in an acute emergency our hospitals are going to get hit with a large surgeon population, and they're going to need to decompress. Sometimes decompressing to skilled nursing facilities, decompressing patients discharged to home, but then those create more effort needed on those other sectors. And we've never really fully exercised that. And how would we prepare and integrate that? So I'm hoping that will come out of that too, not just saying, yes, this is our plan and what we're going to do, but what does that actually mean and how the different agencies will work together. Number six, relationship building and points of contact with response partners. A lot of the communities, they might have fire and law come to their community. Sometimes it's just because they're doing their job. Sometimes they're using the location to run their own drills. But it doesn't really seem as much of sort of as a response partner to really understand what the communities are like, what they mean. There's a assumption that the CCRCs, RCFPs, they need ambulances to evacuate when really it's maybe just a shuttle or a bus can help with that support. So better engagement, better understanding with across the community response partners. Number seven, resident preparedness engagement and shared accountability. This does not work at all communities. I understand that, but for the ones that have really strong resident committees, safety committees, disaster committees, really seem to help getting their fellow residents prepared and almost be sort of like extra support and extra staffing to kind of help with the response and evacuation, or even just accounting for everybody, making sure that they're safe. Number eight, staff sustainment and workforce support planning. Really, because we could see how much of our staff were impacted by this particular emergency, really looking at figuring out how can we support staff on site, or if say we're evacuating our community to another location, how do we support staff being there, whether that's transportation, sleeping quarters, access to food, childcare, all of those types of things that would be in sort of staff support. And then nine, repatriation and repopulation planning for post-evacuation operations. Sort of what we've seen in our plans is that a lot of times in our EOPs, we focus a lot on the planning side and then the response side, but not a lot of our plans go into a lot of detail on the repatriation, the repopulation planning. How do we need to clean up the site before people can come in? What is sort of a phased approach for repopulating a community? And so I think because so many communities actually had to sort of figure out what this process is going as they were doing it, we'll start to hopefully see some more robust planning that actually includes that. And I know I'm talking a lot. I feel like I'm talking a lot. I hope you're still with me. Next, going on to response, the recommendations here. Better government coordination, agency role clarity, and long-term care integration. Really trying to figure out who the lead agencies, we had CDPH, we had DSS, kind of state level, but then we also have some county agencies. We have the EMS agency, there's the Mohawk. What does the Mohawk do? Well, some of them know about the Healthcare Coalition. Does the coalition help me with something? What does public health do? So there's just so many different agencies. And part of this was our communities were getting bombarded with all of these different agencies also calling them for information. And so that also created a bit of confusion. Like if there was one place to know where we have one, one sort of clearinghouse of information, maybe that could be a solution too. All right, let's see. Number two, sector-specific operational communication during incidents. Again, kind of just not only just one agency, but maybe specific information recognizing the extra needs for our older adults. Number three, public notification accuracy, consistency, and redundancy. There were a lot of apps. I think we all used those apps, but it was great. But at the same time, there was also some inaccurate information. So really trying to figure out from the information, again, for us to be able to respond, making sure that that information is accurate, consistent, and sent out in multiple different ways. Again, we get into some of the older adults, maybe some of the technology because they're not normally using it or because in the situation it couldn't get through, just looking for redundancy and how information is getting out. Number four, transportation, access, and vendor capacity, evacuation, routing constraints. Again, this part of it was the access I mentioned before, but also there just weren't enough different types of vehicles to be able to do the transportation, and also sort of the staffing of having drivers available to be able to drive the appropriate vehicles. Trying to figure out how do we build this capability, knowing that we all kind of rely on the same vendors. Number five, appropriate placement and continuity of care during evacuation transfers. There were some residents who went from one location directly to another. That was great. Some went to kind of a staging location before getting to another location, and which may have included the convention center. Again, and there were others, but just locations that weren't really able to better handle the older adults. There were also just different situations where one resident moved to one place for an evacuation. For whatever reason, there are multiple reasons, they couldn't stay there. They then had to move to another location and evacuate again. And some had to evacuate again. So it just increases the stress, the confusion, the sort of trauma of the situation already. And so that goes into the five, appropriate placement and continuity of care. There was some issues about the appropriate information that was going with residents as well in terms of the level of care that they would need and not necessarily being placed to the appropriate location. Access to electronic clinical records, MARS, EHRs, EMRs. A number of places they do that on the regular, so it was easy for them to do during the disaster response. Others really had to get their IT teams involved, so just sort of the recommendation is to better prepare for that, better have IT on part of the relocation team. Number seven, I'm trying to go through this because I really want to get to our panel. Number seven, evacuation related health and safety and risk mitigation. I mean, just thinking about the adverse conditions. There was heat and there was cold, during evacuation. Thinking about the air quality and risk of fall, so many different things related to evacuation, just kind of heightens even more for our older population. 8, resident tracking and accountability across complex movement patterns. So there was sort of what I just mentioned where once they evacuated once, they were going to different locations, but there was also resident tracking. Did everyone safely get out of their building? Did everyone safely get onto the vehicle that we were being transported on? Did everyone make it off the vehicle into the new location? There were paper lists, there were use of cameras, for just literally taking a picture. Here's the person, here's the bus they got onto. There was also cameras that they were able to use in the community to track license plates for folks that were self-evacuating. So it was really complex, and I thought it was really great that we had so many different ways as this was accomplished that could be shared with other folks. Number 9, privacy, dignity, and shelter suitability for older adults, especially at a place like the convention center where it's just kind of open. And sometimes the resources will come in and the more able-bodied folks would swoop in, pick up the resources, and the older adults who just couldn't get there fast enough or didn't have their mobility device with them to go get the resources were kind of left out, and so that's just sort of one story of a way that hopefully we can make that better in the future. All right. I'm going to go to recovery. And number one, accessibility of disaster assistance services for older adults. A lot of them were able to go to the disaster recovery centers that were set up by the different government agencies. But again, a lot of the forms that needed to be done were all online. Or if you're at one of these centers, hello, it's a really long line. Who wants to stand in line and who's able to stand in line for hours on end? Even just some extra chairs would have been nice, some extra guidance on how to do the forms. Maybe senior centers that already exist could be stood up to be sort of long-term helping older adults recover, especially those that had to evacuate from their homes. Flexible documentation standards. So, I mean, one of the quotes is, how do you inventory your whole life, your deeds information, any loan information, all of that documentation that you might have had in your home that now is gone, and you're trying to go back and try and speak to the company to get that information, and they can't even access their records to be able to help you get your information. So a lot of frustration, and that is, I know, still ongoing. And then the sustained recovery, navigation, case management capacity. Number four, trauma-informed behavioral health and psychosocial support availability. A lot of the communities were able to kind of provide that, especially that peer support, but some folks really needed more support than that, and maybe where they might normally go for services wasn't up and running anymore. Maybe it's an increased need for telehealth support, just trying to figure out more ways of getting this information, getting people supported. And then elder abuse, exploitation, and predatory practice prevention. One gal, a neighbor from her old community, was kind of helping her go through things. But then we have sort of a third party trying to help with this process too. She thinks that maybe this gal was being, exploited, not really getting all of the benefits like she should. But when you try to report it, nothing really happens. So there's just that whole process. It's unfortunate that we even have to consider that. And then housing stabilization barriers for displaced older adults. There are just if we're trying to then move older adults into affordable housing and they're not already part of that system, maybe they're there sort of, on a waiver initially, but how do we make that long term? There's so many sort of rules in place, which understand why they're there, but how can we make this a little bit easier for our displaced older adults? All right, I'm just going to do just overall, our recommendations aim to reduce operational barriers. We want to enhance continuity of care and resident safety. We want to support more consistent, proactive, and coordinated incident management from the planning, the response, and the recovery in future disasters. All right, I'm going to stop there because I took a lot of time. I'm going to stop sharing. Thank you, everybody. Thanks for your time.
Thank you, Tamiza. Thank you for all of the wonderful work you have done to create this report that is so full of, just interesting findings and really solid recommendations for California. And so now I'm going to have all of our panelists turn their video back on. And I will reintroduce all of you all because I think we've had a lot of people join since we initially kicked off. And so now we're going to have a panel, and I have a few questions for all of you. 1 year ago, after the fires, we had a panel with several of the same panelists where we kind of talked about the immediate response to the fires. What happened? How is everyone feeling? How is everyone doing? Where are your residents? Do you have residents from other communities? And now we're a year later. And so I'm very pleased to introduce Sean Rushforth, who is the executive director of Villa Gardens, which is a front porch life plan community. Yuri Escandon, Vice President of Operations for Retirement Housing Foundation, a large nonprofit affordable senior housing provider. Keith Kaysen, Chief Operating Officer at Hillcrest, which is also a life plan community, and Andrew Pegsisian, Chief Operating Officer for All Care Home Health and Hospice. And so thank you all so much for joining us. And Tamiza, I would encourage you to chime in too if you have thoughts on any of these questions. Um, so in just chime in, we don't have to go in any particular order. But my first question is for all of our panelists is over the past year since the LA wildfires, how has your organization's experience aligned with some of the findings of this report? And were there any recommendations in the report that resonated with what you have lived through, or any recommendations that surprised you?
Well,
I
Sean,
guess I'll jump in. I'll jump in.
Okay.
A lot of it resonated. I found myself taking more notes today, and I think this is an importance of continuing these conversations and using a real life case study rather than, I think, the hypotheticals that we all think about when we're doing our vulnerability assessments and our EOPs, but really looking at these case studies and being able to share. So thank you for the report and thank you for this opportunity. So yeah, a lot resonated, especially for me about leveraging our residents and using them as part of the solution. We're very fortunate at Villa Gardens to have a very strong resident safety committee. But I think one of the things that has come out of this is how do we collaborate more? Having residents on our employee safety committee, using residents in our after action reports. So, when we had a power outage, going to the resident safety committee and say, how did you experience that? What went well? What didn't go well?
Mhm.
How do we train our residents? We sometimes focus so much on how we're going to train the employees, but how do we train the residents and work with our residents to help train each other? I think was one that really stood out to me. There's more, but I don't want to take all the time. Keith, I
Thanks,
know you
Sean.
said
Yeah.
something.
yeah, thanks, Sean. Actually, it's great to hear you say you're leveraging your residents and getting them involved. I think for too long, too many communities didn't want to do that because they were thinking of the litigious side. If we get residents involved and something happens, we're going to be on the hook. Now I think we've gotten to the point, it's like, our prime staffing in most communities is probably 7 in the morning until 3:30 in the afternoon. And then it starts tapering off as shifts go home. And then on the weekends, you're already light because you don't have a lot of that administrative staff in. So I've always
Mhm.
said, there's 1/3 of the day, 5 days a week, when we are optimally set for a disaster to happen from a staffing standpoint. So we have to get residents involved. So I'm glad you're doing that. From my own thought, and it felt a little bit like what's that game show? Like who's going to hit the buzzer first and when? I didn't want to hit the talk button too quick and cut somebody off. Um, but what resonated with me, and yes, I did participate with Tamiza. I had a wonderful 2 hours speaking with her. And after that, after she left, I thought, wow, I never heard any talk about a survey, creating a report, really going out and seeking information after the Paradise fires, which
Mhm.
also involved older adults and senior living communities. And I thought, I wonder if that's been done. And if it did, why didn't Southern California, LA County learn anything from that? Or if they did, then, and we still had this amount of problem, we didn't learn enough. If
Mhm.
that exists now, I think we need to go back and try and compare and contrast and see what they've learned as, part of Northern California to Southern California.
Yeah.
But as a community here, like Sean, I think we didn't have to evacuate. We were bringing people in. I felt very, very fortunate to be on that side of it. Although for a couple of days there, I was wondering, when are we potentially going to be put on the warning? And everybody
Mhm.
said, "Oh, that fire will never jump the 210." I live in Redlands, and I always remember back to 2003, 2004 with the Blue Cut fire that jumped the 15 freeway in Cajon Pass, and I said, "It can happen." And
Mhm.
as we took residents in and started talking to them, and some of them said, yeah, we were having dinner out on the porch and we're looking at this fire way to the north of us. And all of a sudden we realized there was little embers blowing over our heads and it landed in a tree and boom, their community went. It skipped area before it got to them. We have to be prepared. And as I'm working on reviewing and updating again our emergency response plan, and I put that EVA out with team last month. Interesting, I was looking at the last EVA or HVA, hazard vulnerability assessment, and what we did now, and the top 5 have shifted. The only one that didn't move was significant earthquake. That's still number 1. But
Mm.
prior, a wildfire was number 6.
Oh,
Now
wow.
it's number 2.
Good.
And the plans that we have put in place, just as we've modified since that fire for our campus-wide evacuation, if it needs to happen, and where the trigger points will be to start
Mhm.
doing different things, has really shifted. Because we also heard from communities, oh, we had go bags, we had
Mhm.
them out, but when the firefighters came, there wasn't enough time. They wouldn't let us go back and get them.
Mhm.
They were still in residents' rooms instead of being like at the front door.
Yeah.
Lesson learned, and tag them and bag them better. Think more than just 3 days. Maybe if you've got advance notice, you want to take a little bit more because you might not be coming back longer, or you might not come back at all, as some of these communities found out. Um, and communication planning, incorporating of residents, but then also as a large CCRC, recognizing how many independent residents will probably be bailing on their own. Yeah, we still
Mhm.
have to account for that, and who else is jumping in their car.
Yeah.
So that when we're loading buses or whatever other vehicles we may have for a mass evacuation of those left, we have an absolute inventory, because we do not want to be that community where all of a sudden somebody got left behind. So how do we assure and have the best practice in place for that? And then on top of that, expanding our emergency notification systems to do better, also communicating out to families of what's
Mhm.
going on, how they'll be able to get information, where our target points are going to be if we start to evacuate, um, so that they can come find us in a safe place if we need to. I'll
Yeah.
let go of my button and let someone else jump in.
Yeah.
Well, so I want to follow up with Andrew and Yuri and give you both a chance too, because you all both operate in slightly different settings, right? So Yuri, you're working with affordable senior housing, which is independent living. It's not a regulated housing setting, in terms of like it's not a care setting. And Andrew, you're providing care in people's homes, and your company's provide is going into people's homes and providing care. So my question to Yuri and Andrew is, what have your organizations done over the past year, and how have you changed, you kind of your operating procedures because of what happened with the fires in 2025?
For my appreciate what Keith and Sean shared. I think for us, what has changed is we really took a closer look at the frontline staff and the amount of work, not only work, but I would say trauma emotionally,
Mhm.
even
Mhm.
logistically, right? Because some of our staff had some clear and present issues going on at their homes, but we were asking them to focus on our residents. So I can tell you that there's a lot of things we can do with plans and everything, but that's something that I've really focused on is we forget about everything. It's no longer in the news. But because we were able to actually house a number of those displaced residents, not just our own, but others, we had some vacant units, we were able to move them in. We know they're still dealing with some trauma, but we also know that the fact that our employees are dealing with some of the trauma is very real to us. So I'll let Andrew speak.
Yeah, so we're in a different environment where we're at patients' homes and we have to account for them. Exactly what Tamiza is saying is, and to compound with Keith as well, is like we have to figure out where they're going on. Again, when you're in one facility, you have all the residents there. And home health and hospice, they're everywhere, and there's a limited amount of resources. And then really trying to collaborate a lot more. What we learned from this process from 1 year till today is how can we prepare all our communities individually, making sure they can be independent. If they cannot, who are the partnership that we have? With LE Disaster, with the EMS services, as well as our community home CCRCs, ALFs, and then really try to figure out how these movements are. But it's not only movement of individuals, but it's also like resources, DME companies, supplies, and who is out there, especially with working with, you know, the community centers, like, Pasadena Community, which for my area is really trying to figure that out very quickly because we have individuals' memory care issues, we have individuals' physiology. And taking a look at the government coming from the National Alliance as well as here is like really taking a look at what can we do to prepare all our communities, not only in our own sector, but also cross sectors as well, where we could get everyone to success to individuals and to groups. So that's what we really learned. And what we have for our residents is, hey, pretend that you have a go bag, right? What if where are you going to put it? We've actually partnered up with Lowe's and Home Depot, especially with IHSS, and say, hey, in case of emergency, what is the best plan of action? And really modify homes as well as modify, other aspects of it where individuals could be successful.
Thank you. So another question for all of you, for anyone who wants to answer, that this report emphasizes communication as a critical success factor. And so how have your communication strategies with residents, families, and staff evolved since the fires? And what are some systems or protocols now in place that weren't before?
I'll go ahead and take a jab at it. So right now, compounded with Sean and Keith and Yuri is like, how do we communicate with our family members, right? Again, there's some where they see things on the news, and how do we settle that noise? So, I mean, there are patient portals right now with the health plans, and how fast can we output that? But we ended up seeing that text messaging is probably one of the best things right now because it hasn't been invaded by spam.
Yeah.
But also, it's like, okay, now that we have systems of, messaging out, what is the response and how quickly, right? Like push 1, 2, and 3. So we implemented that just for not only for our patients, but also for the caregivers as well, just to keep that, as ease, as transparent as we can.
Great. Thank you.
I think one of the things that we realized, so we were fortunate, we did have a platform that allowed us to communicate via text and email. But given the diversity of our audience here and our internal residents, we realized that we really needed to look at other ways. And so we've added a text to voice option so that people can receive a phone call. Because many of our residents who weren't tech savvy needed that option. And during the actual event, we were knocking on doors, and I think we would still do that with paper. You want to have redundancy in that communication. But the other factor that kind of came out of this was recognizing the importance of updating those contact information and communicating with our residents on the regular, of giving them opportunities to review what we had. Because we had a few incidents where a family member received our message, but the resident themselves didn't, or vice versa. And, numbers change, emails change, and you need to keep that current.
Yeah.
I would say challenging also is navigating all these fair housing requirements where we want to make sure that we respect privacy, confidentiality. And the more we move that direction, the further we move from being able to communicate with our residents. I mean, many moons ago, we used to be able to even, on a door, be able to have the red or green little tab on. We can't do that anymore because someone, filed a fair housing complaint. At any rate, we have to navigate through those challenges and, more importantly, communicate to the residents. Look, during this incident, we weren't able to communicate with many of you. You're not using the systems we have in place. We need you. We need you. We can't make it mandatory, but we really want you to adopt this. So I think that's always a challenge. It's balancing those two. We want to get in touch with them. We want to stay communicated, but we also have to abide by these guidelines that have been set before us.
Yeah. Thanks, Yuri. It's a different beast on affordable housing. There's levels of duty, right? Where Keith and Sean and Andrew, you all have different duties of care, and then Yuri, you want to have this duty and help your residents, but sometimes it can be really difficult. So Keith, we'll give you the final answer before we conclude today.
Yeah, final answer. It was a good one, because we've had a system in place that would send out a phone message, a text message, and an email. And it's got the capability of going to landlines and cell lines and all of that. But we really found how many residents didn't want to provide their contact information because I think maybe to Sean's point, they felt here we were going to spam them, and assuring them that, this system was not for sending out, we're having a luau dinner tonight or something like that for emergencies. And then encouraging to also have families give us, their contacts so that we would have a way to push something out. But in that same thing, what we found, um, text works really well. It all relies on the cell towers. And even though we were, just to the east of this whole line, how many cell sites burned down on the hilltops? And it took, as I drive back and forth to Redlands, it was over 6 months before there was actually solid cell coverage between Laverne and Redlands. So it does take those systems down. So making sure you've also got an alternate backup plan um, where we can get information out. As far as a community, as we were doing so much with cell phones and all that, we've really stepped back up into the handheld radios. So we know across the community, and if we've got vehicles out and about, that we can communicate with drivers and staff. And our CERT team has also really built up in their radio communication skills. Again, recognizing the importance of a resident team working with a staff team, and not only do you have to trust each other and know that they're going to help, but also be able to communicate so information is going back and forth quickly, and what that does to cut down on some of the runners going back and forth across the community at the same time.
Wow, thank you. So interoperability is an important part of communications. Well, thank you. It is 2:01. We've gone a little bit over, but this has been such an important conversation. I really want to thank all of you panelists. A huge, huge thanks to Tamiza Teja, who has done such incredible work on this report. It has been such a pleasure to be your partner on this. And I also want to give a huge thank you to the SCAN Foundation and the UniHealth Foundation, who have funded this project and worked alongside of us. And so thank you all for joining our webinar today. And I just hope that we can all take this opportunity and make the most of the opportunity to grow stronger and more resilient together. So thank you all. Have a great afternoon. Thanks. Bye.